I'm going to show you how to do range of motion on a dog. Not all dogs are going to be receptive of this. Your older dogs expect to have more restriction. Homer is 4 years old, a Labrador Retriever, and he's my go-to guy. So when we do an evaluation on a dog, we're going to look at the stance. Some dogs can have hip dysplasia, so they'll have more of a sinking down look. And as you eyeball more dogs, you'll get way better at looking at different things with conformation. So starting out with your range of motion, you take and you come up right behind the back of the ear. It just kind of does a nice little dip. And what I do to go to the left, I just grab his muzzle and I just kind of turn it. And I just kind of work down that whole neck all the way to the front of the scapula. And then I do the other side. Homer has very good range of motion. If we had a dog that had poor range of motion, it would be very obvious. They would pull their head away real quick, or that'd be about as far as they could go. And you can look at teeth, look at the gums, just make sure they're nice and healthy and pink. Some dogs, the darker dogs, their gums will be black. And I just kind of feel down. I feel down the muscles. I'm going to have Homer stand up here. Good boy. So now what I'm going to do is I'm just going to feel around that whole scapula. And I'm checking for tenderness. Then I take my two thumbs. I lay it, you'll feel the tips of the scapula. There's a little dip right there. I take my thumb, because that'll be the start of your thoracic vertebrae, and all you do is you run down the back on each side of that vertebrae, and I'm obviously looking for reaction, which she wants to sit down when you get in there. That's normal. Dogs that have misalignments are going to be very reactive. You can go down and push, find the tip of the vertebrae and just kind of push down to verify if there is a vertebrae out. For stretching, to check range of motion for stretching, I usually grab the dog. I have them hold it till they relax. I put my palm on the back of their elbow and just kind of push forward. I take and put my hand in front and go back. And I would do that on both sides. For the hind end, same thing. You may have to have the owner hold the dog so you can hold the belly up, because some dogs do want to sit down. Same thing. I just kind of extend it back. As you can see, Homer's got very good range of motion. And then I come forward. We would do that on both sides. Obviously, Homer has no issues. A dog that does have restriction, that would be an area you want to concentrate on.